I'm very excited to announce our latest initiative at ADRA Canada. It's a program that focuses on maternal, neonatal and child health in 4 countries, 1 in Africa, Rwanda, and 3 in Asia, Burma or Myanmar, Cambodia and the Philippines. This new initiative is going to be running for the next 4+ years and will mobilize our ADRA partner offices in those countries as well as here in Canada with some very exciting interventions to help mothers and children.
The Embrace program is set out to save the lives of mothers and children in very remote challenging areas, not easily accessible, where services are non-existent at all. There's a high incidence of dying before the age of 5 in those areas where we will be working. And at the same time, mothers also die at childbirth or even after or before childbirth. These are deaths that could easily be prevented with proper care and help. One of the big problems that we have seen in the remote areas that we are targeting is that children are not growing as they should be. So that is called stunting. But it's not just limited to the physical growth, but more so in the mental capacity, that they don't develop into their full potential. If you don't get enough nutrition within the first 1,000 days of life, the brain does not develop properly, and unfortunately this is irreversible. Embrace will help by improving the level of essential or basic health services in these areas, and secondly, by providing improved access to nutritious food for mothers and children. We are looking at building clinics in very remote areas and also waiting or birthing centers for the mothers. The 4 countries were selected based on need. If you look at the current statistics for malnutrition, you will see that these 4 countries are among the top in terms of the number of malnourished children. Pregnant mothers face a lot of challenges, especially in these remote areas. We are starting with an education campaign. So our entry point is on nutrition, and we're helping to train midwives also, because the midwives are the ones that are there all the time. There's rarely a nurse or a doctor that you can find in these remote communities. ADRA Canada has been very fortunate to be one of the recipients of the funding from the Canadian government for the large projects. So the large projects are anything 20 million and over. The other recipients are much bigger than ADRA Canada in size, so it is humbling to be part of the top 7. For us, it means that the confidence of the government is definitely with ADRA Canada. The Embrace proposal process was very intense. It started with the call for proposals in November. We had to submit by mid-January, and by June we got the good news that our proposals were favorably considered, and then we had to provide more of the details of the intervention, and then finally we got the proposal signed in February 2016. So including all of our partners in the field and partners here in Canada, around 26 people have been working on this proposal for over a year. We have been given big responsibility, and with that comes accountability, not just to the donors, but more so to the mothers and children that we have committed to serve.
Annalyn has told you about the details of this program, and you can see that there's a part for each one of us to play. This program is the largest of any of the programs that we've ever had in ADRA Canada, and over the next 4 years the activities will cost about $26 million. The Government of Canada, through Global Affairs Canada, will be contributing approximately $21 million, and we will need to raise approximately $5 million for our share. I want to thank you for joining us on this journey. During the coming months, we will share with you details and stories of what is happening in these countries. And I want you to pray for our partners, pray for our fundraising efforts, pray for our staff. And of course, I hope that you will contribute and find others to help you also provide the financial assistance to make this program a great success.